I mean, I can't emphasize enough to the community docs the pneumonias that come with the immune treatments.
And just tell us a little bit about those patient characteristics, because I know you and I have talked about they don't present like your typical pneumonia.
Yeah, well, I think that as we introduce immunotherapy in particular, and we're most familiar with daratumumab, but I would also say for the upcoming drugs, we're seeing a lot of respiratory infections. And I think what we're seeing clinically is they don't present like your classic ID findings with fever and chills. You may have a patient often that's elderly, is on, for instance, daratumumab, comes in and says, I feel bad. And they're not coughing. They're not clearly febrile, but they definitely feel bad. We go straight to a chest CT, and we find pneumonia all the time. We don't even bother a low-dose chest CT, which our hospital fortunately does in our patient population in clinic because we see so much more. And then those patients need to be treated very aggressively. And what we see is even these viral infections that are so pervasive in the winter, they get a secondary wave of bacterial infection. And when we have junior doctors and students rotating through and they see these patients, it's not on their radar screen because this is not the usual way we think of community-acquired pneumonia. And
do you usually treat those patients as community-acquired pneumonia?
Well, we do the respiratory viral screen because at least it tells us if they have influenza, and your labs probably do too, but we pick up metapneumovirus, a few rhinovirus, occasionally paraflu, which is an evil bug. At least we know what we're dealing with, and some of them are quite protracted. We do cover them for antibacterials. If only, I hope it's not treating ourselves, but they often will get better from this URI, and then they get pneumonia. So our fantasy is by having them on antibacterials, maybe they don't get as ill, but we've had a number of people go to ICU, and even patients that refused antibiotics, and then within a week, they had an upper respiratory, within a week are in hospital with a significant pneumonia. So I think this is a new lesson for us.